Good afternoon to everyone present here with us today. This is Rion from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by your keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned Professor Dr. Sunil Kumar Agarwala. Sir is MBBS MD Professor at the Department of Pediatrics, Sardar Vallabhbhai Patel Postgraduate Institute of Pediatric, Cuttack. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is current status of HPV vaccination. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Thank you, Slian, for your kind introduction. And I must thank all IJCP group behind this for making this session lively. And good afternoon, all doctors who are logged in here. So here, I must start like this, that a very good Happy New Year 2025 to all of you. In spite of your busy schedule, you could able to find some time to listen this morning topic of HPV prevention and vaccination. As we all know, that current status of HPV vaccine, so 2006 onwards globally, now we are having a footfall of this vaccine in order to prevent, what can I say, prevent HPV disease. When the vaccine was launched at that point of time, everybody knows this is to be given to the girls only, not to the boys, and it is basically made in an interest to prevent cervical cancer, who is one of the important cause of woman cancer in a lady, particularly breast cancer and cervical cancer being the commonest cancer in a woman. Breast cancer cannot be prevented by a vaccine, but a preventable cancer to the tune of 100% by this HPV vaccine. So there are multiple questions that come to our in our brain, that can we solve these questions. So coming to in a question mode, number one, does HPV cause only cervical cancer? So why this question is important? Because many a times we are now interested the vaccine to be given not only to the girls but also to the boys. How rational, how ethical, and how important we are making this line. So let's see what the slides are saying. There is a linkage between HPV and cervical cancer. As you all know, the presence of HPV in virtually all cervical cancers. I'll make all cervical cancers. That means 100% cervical cancers implies the highest worldwide attributable fraction so far reported for a specific cause of any major human cancer. For an example, previously we all came across with hepatitis B vaccine, which can cause hepatocellular cancer in the long run in the latter age group, but that is not the sole cause of hepatocellular cancer. There are many other multiple causes of cancer, liver cancer, other than hepatitis B. But here, the only, the 100% cause of cervical cancer is because of this HPV viral disease. Now, this virus once enters, it causes a infection in the local mucosa, and usually the body immune system that takes out this infection from the mucosa level out, they do not allow for the invasion or carcinoma in situ or cancer in the long run, and that is only possible because of the immune status of the body. But if it evades the immune status and it is locally invasive, then only it can cause cervical cancer. So this is a beautiful subject in human cancer. What I say in the domain of human cancer, particularly in human cancer, that this particular cancer is related to HPV. So if we are giving HPV vaccination, particularly we are 100% eliminating the chance of cancer cervix in a woman. So cervical cancer mortality, let's see the epidemiology. This is the second cause female cancer after the breast cancer, and second leading cause of cancer death in women aged 15 to 44 years of age. Approximately 67,477 deaths annually, and we say 70,000 odd deaths occur annually in India. Approximately 185 women die every day, and approximately 8 women die every hour. And a woman. So what we are seeing that this, just a minute.
Sorry to interrupt, sir. Your screen is not sharing anymore.
I am doing that. Is it visible, Sriyan?
Yes, yes, sir. It is visible. Just make it full screen, sir.
I am doing that. I am doing that.
Thank
Sorry
you,
for
sir.
the inconvenience. Thanks, Sriyan, for the guidance. So here I'll be telling that cervical cancer mortality in India is to the tune of 70,000 deaths per year. And our goal, motto, as per the SDG goal, the 2030 goals is that 90% of girls are fully vaccinated against cervical cancer at the age of 15. So our motto is to make it available in the NIP. 70% women are screened for cervical cancer at the age of 35 to 45. Any woman in between the age of 35 to 45 should be screened for cervical cancer in spite of getting vaccination or not getting vaccination. 90% of women with positive cervical screening receive the treatment as early as possible so that the total bulk of the cancerous mass will be taken out and the lady will have a normal life beyond that day. So HPV causes many more cancers. So this is a news I want to tell you that HPV is not only causing cervical cancer. You see, it is causing so many cancers other than cervical cancer, particularly coming to women. It is 100% responsible for cervical cancer, 70% responsible for vaginal cancer, 43% responsible for vulvar cancer. Now coming to the main, that it is 88% responsible for anal cancer and penile cancer 50%. Oropharyngeal cancer, including cancer of tonsil and base of the tongue, 13 to 56%. So it is not only a cervical cancer prevention vaccine, but as well as there are other cancers, they are also contributed by this HPV virus. So when we are saying cervical cancer is the second most cancer in women in India, and HPV infection can also cause anal cancer, vulval cancer, vaginal cancer, which have no routine screening recommendation. Low 5-year survival rate despite treatment is very low. And overall genital wart prevalence in India was estimated at 1.07%, was higher among men than women. So there are two diseases they are being caused. One end, there is oncogenesis, that is cancer. Another end, they cause some wart-like growth, not only in the genitalia, but also in any part of the body. Precancerous cervical lesions are common in India. Prevalence rate CIN, cervical in situ, cervical cancer in situ, 1, 2, 3 are 2.3, 0.5 and 0.4% respectively. So the main message is that this is not only causing prevention of cervical cancer, but as well as other cancers are also prevented in women. So now the first question was that whether it is going to prevent only cervical cancer or other cancers are also preventable. So the final answer is that other cancers like I can say vaginal cancer, vulval cancer, anal cancer, then comes penile cancer in male and oropharyngeal cancer. Other 5 cancers are also possible to protect by giving this HPV vaccine. Now, second question, why protecting boys against HPV is important? Many a times when 2006 onwards, when the HPV vaccination was in pipeline, at that point of time, everybody knows this is a gender biased vaccine. Now, this has been meant to prevent cervical cancer. Now we are thinking there are so many countries like Australia, they started this cancer prevention vaccine, particularly in boys as well. Now whole world is moving towards the gender bias vaccine. That means it is not a gender bias vaccine, it is a gender neutral vaccine and it has to be protect against a male as well. So now global burden of HPV related cancers and diseases in male and female. HPV infection is estimated to cause up to 4.5% of all new cancer cases worldwide. And it has been said that near about 7 lakh cases of HPV related cancer diagnosed in males and females around the world. Now, I have already told in case of female that if you see oropharyngeal cancer is 11,000, that means 100, and here the oropharyngeal cancer, the total number is more in male. Then recurrent respiratory papillomatosis, which is a benign condition, but it is lesser in female and more in male. anal cancer to the tune of 9,900 and 19,000. If you see anal cancer, so that is more in female. Then comes genital warts, 17,300 versus 14,000. It is more in female. Then penile cancer, 18,000, and cervical cancer, 5,70,000, and vulvar and vaginal cancer, 25,000, and millions of cases cervical dysplasia. So it means that it is a epidemiologically burdened disease, not only in the segment of warts but also in the segment of cancer in both the sexes. That means boys and girls, male and female as well. Now, most HPV infection clear on their own because they stay for 10 years and the body immune system kick out them from the mucosa. But persistent infection can lead to certain cancers or their diseases. Now, if you see the burden of the cancer, it goes down from the 25 years, 35 to 40, and again it picks up. Those who are eliminated, they are out, but some of them are going to cause persistent infection and thereby causing invasion and cervical neoplasia in situ. Now, as the age advances, in case of male, you see this is increasing, and from 30 to 34 years, it is declining. Again, it is coming up in the form of penile cancer, anal cancer, and oropharyngeal cancer in male. So, what I mean to say that HPV prevalence in male in India, HPV prevalence among men in India is 26.7%. In the cohort where their spouses are suffering from cervical cancer, HPV prevalence among male is 66.7%. So it's a huge burden of cervical, HPV prevalence among men is there. Now I will tell you one thing. Who donate this HPV virus to the female? Who is naive to HPV virus? It is the male. So it is prudent that you have to vaccinate the male as well, because if you vaccinate, they are not having HPV, then how come a female is getting HPV virus during sexual intercourse from male to female? So screening recommendations for HPV related cancers and diseases. We all know that established screening programs are there: cervical cancer and pap smear in case of male, that is 35 to 45 years only. No routine screening and recommendations are there for other cancers. So that means no routine screening program is there. So only way of prevention of those cancers is left with HPV vaccine. Now HPV transmission from male to female. This is a very a good study that the female to male is higher. That means female to male is higher if male is naive and female is having HPV infection. Then the transmission of the virus rate is 12.3%. However, if the male is there, then it is transmitting to the female is only 7.3%. So this is a study which shows that this virus can transmit from an infected male to a female and female to a male as well. So gender neutral vaccination also facilitates more rapid reduction of HPV prevalence. Now it has been seen, if you see this graph, female only vaccination, this epidemiological presence of the infection in both these sexes, that goes down. But if you are having male and female, then definitely the HPV prevalence will be much more lower once you are giving a gender neutral vaccine, particularly both the sexes. Why male HPV vaccination is important? Already I told, male remain susceptible to HPV infection throughout their life. And many a times we get this infection from female to male and male to female. We have already discussed absence of routine screening in the male, susceptible to new and recurrent infection, gender neutral vaccination program increase the protection, high prevalence rate of infection across all age groups, at risk for certain diseases and cancers we have discussed beyond anal and penile cancer, such as oropharyngeal cancer and cancer of the tongue, and low rates of seroconversion. So gender neutral HPV vaccination may enhance routine adoption of HPV immunization in office practice. Now it is clear that this is a vaccine to be given not only to the female for the cervical cancer prevention, but also in order to prevent other 5 cancers in both male and female. The vaccine should be given to the male as well. And globally, this acceptance has been made initially to start with female, and later on, they are jumping to both the sexes as well. So coming to the third point or question, understanding the currently available HPV vaccines, how the new 9-valent HPV vaccine will make a difference. Now, Cervarix was the GSK vaccine, which was a bivalent vaccine, 16 and 18, that is no more available from GSK now in India. Now, there are 2 vaccines available. One is from MSD, that is Gardasil. Now, if you see Gardasil 4 and Gardasil 9, so let's have some knowledge on Gardasil 9, which is a non-avalant vaccine. Now, 40 serotypes of human papillomavirus can infect man. Human, over 150 serotypes are there, and there are 40 infect anogenital area. High risk means oncogenic, low risk means they are watogenic. Most HPV infection clear of their one. Persistent infection have a oncogenic potential. They can cause cancer at locally. Non-oncogenic types can lead to low-grade cervical cells changes and genital warts. HPV by electron microscope, it looks like this. Now, if I tell all the groups or elevations on the surface of the HPV virus, they are known as serotypes. Now, these 40 serotypes, out of them, only 9 are responsible for causing cancer. So, out of them, the 6 and 11 are causing warts. 16 and 18 are the most common. I mean, 75 to 80% cancers are done by the 16 and 18 serotype. If you are having a vaccine, definitely 16 and 18 has to be there, 6 and 11 for the warts, and you can have additional 5 serotypes in a non-avalant as well. So look at here, 16 and 18 are the most common oncogenic serotypes in case of HPV. 6 and 11 mostly responsible for warts. 31, 33, 45, 52, 58, all 5 are the additional serotypes which can cause different cancer in male and female. So can 9-valent HPV vaccine help to reduce HPV related cancer burden in India? Definitely. If you ask me which is the best HPV vaccine available in India, I will go for non-valent vaccine. Only the cost is prohibitive because its cost is around 11,000 per dose. 98.4% of cervical cancer cases attributable to 9 serotypes against 90% of global. So 98% are covered. 95% of vulvar pre-cancer are covered. 77% of vaginal and 73% of anal. So if you see to the tune of 100%, I mean the serotypes, they are covered in this non-valent HPV vaccine. So to summarize, 9-valent HPV vaccine effectiveness in girls and boys in between the 9 to 15 years, 2 doses. Girls and females of 16 to 26 years, 3 doses. High and sustained prevention of disease associated with other 5 serotypes are there. Non-inferior to quadrivalent with respect to immune response, all those things. Antibody responses, that is female, the 9 to 15 years, male 9 to 15 years only, non-inferior to response in female 16 to 26 years, and experience with non-valent HPV showed durable antibody response, and the adverse event profile was like that of quadrivalent type. There is no added adverse event by adding 5 serotypes in non-valent. So this 9 or non-valent HPV vaccine now available from MSD, and always remember this vaccine is given intramuscular. 9 to 15 years, there are 2 doses instead of boys or girl, whoever he might or she might be. So only 2 doses. 15 year above, 3 doses to be given, but only boys to be given 9 to 15. 15 year above, the girls are only recommended up to 26. This vaccine is not recommended beyond 26 in India. However, this vaccine is already approved till 45 years in US and UK in other parts of the world. So now have some gist that just 2 doses of HPV vaccine in the age group of 11 or 12 prevents HPV cancers. So nowadays we do not mention it is a cervical cancer prevention vaccine. Rather, it is preventing HPV cancer. Don't let cervical cancer stop you. Get vaccinated and get screened. Even if you are vaccinated, 35 to 35 to 45 year a woman has to go for 5 yearly that pap smear screening or cervical cancer screening. If you detect early cancer or carcinoma in situ, definitely the treatment has to be picked up and started early so that the lady or woman have a normal life almost. Now this is the Gardasil 4, which is having 6, 11, 16, 18, and it is available with the cost of 4,000 rupees per dose, and it is given as the only vaccine to be recommended in female as well. Female in India now from the age group of 9 to 45 years, not recommended for boys. How does this vaccine work? When the vaccine is given, it is a kill vaccine. The body makes antibodies response. If a person is then exposed to the real virus, the antibody they exude into the mucosal surface, and they do not allow the attachment of this virus to the mucosa. This is called immunity, and everybody know that before the HPV enters, they should get immunity prior to sexual exposure, and that's the reason why 9 to 11 years or 9 to 14 years is the priority age group for giving HPV vaccination. How successful is the vaccine? Already we discussed. We have already seen some great results from the HPV vaccine. Reduction of HPV types responsible for most cervical cancer, having making the 50% reduction in number of abnormal pap test results, the near disappearance of the genital warts after use of this vaccine. How do you get HPV? Where you are going to get? You see that 9 out of 10 people have HPV at some time in their lives. So it's very common. Both men and women can get HPV. Now you cannot say this is a gender biased vaccine to be given to the girls only. You can be exposed to HPV the first time you are sexually active from only one sexual partner. This can be. It's not related to multiple sexual partners. Then only you get. No. At any point of time, there is 90%. I mean, 9 out of 10 people have HPV. At some point of time, they can get this virus genitally. So vaccination, it can prevent some type of cancer. It has lasting benefits, long-term immunity. It is safe vaccine. I think it is important to give the vaccine irrespective of the boy and girl before the sexual exposure. That is, the ideal age group is 9 to 14 years. It can prevent a common infection which can lead to not only disfiguring warts but also prevent 6 types of cancer. So what is the age group? Girls 9 to 14 years, that is 2 doses. Only in cases of high risk or immunocompromised children or immunocompromised adolescent, 3 doses has to be followed. 15 years and above till either 26 or 45 years, 3 doses, 0 to 6 months has to be given. Now this is the brand Sarvavac, which is a made in India vaccine. That means Serum Institute of International Limited from Pune. That they made this vaccine with a very affordable cost of 2,000 rupees MRP for dose, and they are planning to give supply to the government of India so that it will be rolled over across the country in NIP. So this is the vaccine, and for 15 years below 2 doses and 15 years above 3 doses has to be given. Now Sarvavac, India's first indigenously developed HPV vaccine against cervical cancer, as I have already described. Vaccine for cervical cancer in India. Why we are talking? Because the same thing from Gardasil, I mean MSD, they are charging near about double the cost. That means 4,000. So if you are giving 4,000 single shot to a girl and 4,000 two girls are protected at that same cost, then why not you go with 2 girls? But in office practice, as of now, the recommendation either by ACVIP or either by Government of India to go for 2-dose schedule rather than single dose schedule. Now these are the adolescent girls, so now they can be my daughter or your daughter, doesn't matter. They should not die, or they should not have cervical cancer in the long run as they grow or as they have a post marital life. So that is the reason you can prevent a death related or death causing cancer, that is cervical cancer, by giving only a vaccination at the right time with the right duration doses. Now, every girl has the right to take HPV vaccination, that is from 9 to 14 years old. So, which type of vaccine is Sarvavac? It is a kill vaccine. How is the vaccine prepared? It is prepared by so many methods so that they can contain 4 types of serotypes, that is 6, 11, and 16, 18, and that we all know what is the mechanism because it involves the T and B cell. So that's why long-term immunity is there. Discuss the need. Yes, definitely it is needed for both the genders. What are the side effects? Totally, whenever you are giving any antigen, there will be local soreness, some pain, swelling, fever. Maybe there are no serious or severe AEFI has been reported after this vaccine. So always remember the route of entry or route of giving this vaccine is 90-degree angle, that is intramuscular route has to be given. And almost I will tell that this vaccine is very safe vaccine. It can be given to boys and girls, and particularly in a 9-year plus, we are choosing the deltoid intramuscular. So deltoid is the best site for the intramuscular doses in 9-year boys and girls. And this is the Gardasil 4 looks like from the house of MSD. And Gardasil 9, which is the costliest vaccine as of now, just like Singarix from GSK, which is herpes zoster vaccine. So that is 11,000, and this is also costing 11,000. So HPV vaccine 9 in 1 formula, 3 doses. That means 3 doses, 15-year-old and above. Below 15-year, above 9-year, 2 doses has to be reported, or 2 doses has to be given. 9 to 14 years, 0 to 6 months. that either of the way you are giving 4-valent or 9-valent. 15 to 45 girls and women only Gardasil 4, and 15 to 26 years girls 9-valent can be given, and 9 to 26 years either of the Sarvavac or 9-valent vaccine can be given. These are the two vaccines recommended in boys. Going to include in NIP from this year 2025. Target to prevent 80,000 cervical cancer death in India. So, what are the key messages? Though HPV is a necessary cause of cervical cancer, it is responsible for a range of diseases in women as well as men, including genital warts and a variety of cancers. India contributes to one-fifth of the global cervical cancer burden and also reports high prevalence of genital warts, making HPV a cause of concern. Although considered a woman's health problem, HPV is a significant contributor for diseases in men, hence both men and women should be vaccinated. Gender-neutral vaccination provides male with an equal opportunity to have direct protection. The HPV vaccine provides protection against HPV, which could cause anogenital warts as well as cancers. The immunogenicity safety of this vaccine is well documented in young and adolescent girls and boys when given alone or concomitantly with Tdap vaccine or other vaccine. No side effects across reaction has been mentioned. Routine HPV vaccination is recommended for females and males at 11 or 12 years. Minimum age is 9 years that has been recommended by IAP or ACVIP. Now, I have already told what do you mean by 3 doses 15 year above. First shot, suppose let us think it is given today. Then 2 months after second dose and 6 months after the first dose, it is given the third dose. The first and second, the doses is 2-month interval, and this minimum 3-month interval, that is second and third dose. And minimum first to third dose, minimum 5-month gap is required. So that we have to keep in mind. 0 to 6 is the recommendation beyond 15 years, and 0 and 6 is the recommendation before 15 years. Now let's have a look current status. Protection from a single dose of HPV vaccine, International Agency for Research of Cancer, and WHO has highlighted even if single dose of vaccine can protect to the tune of near about 80% plus. So if you are equipped enough, if that much of stock is there, we can go for the 2-dose schedule. But let's start with 1-dose schedule. By the way, we can prevent a lot of cancer death due to cervical cancer in the country. And single dose of the HPV vaccination schedule is expected to improve access to the vaccine, offering countries the opportunity to expand the number of girls who can be vaccinated and alleviating the expensive burden of governments towards the management of cervical cancer. So that's the reason. As of November 2024, this is the latest data, at least 144 countries, I will underline, 144 countries included the HPV vaccine in their NIP. And the primary target group is vaccine is young adolescent girls 9 to 14. And here are some updates. Single dose vaccine. As of September 2024, 57 countries are implementing the single dose schedule for the HPV vaccine. The WHO estimates that this schedule has reached at least 60 lakh additional girls with the vaccine in 2023. New countries, 30 new countries have introduced the HPV vaccine, including Bangladesh, Indonesia, Nigeria, and its status in our India. You see, the India is making progress in its HPV vaccination program. The government has allocated a budget for the national HPV vaccination program, and hopefully we are going to roll out this vaccine in our NIP in this year only. The Serum Institute of India is the largest manufacturer of almost many antigens supplying to the Gavi countries and Africa, is manufacturing 70 million doses of the HPV vaccine per year and plans to double the manufacturing 140 million doses by the year of 2026. So having said that, the HPV vaccine Sarvavac is being rolled out in India in 2023 and 24 in private market. 23, the vaccine was launched in 23 after being approved by the India's DCGI in January. In 24, the vaccine will be given to the girls between the ages of 9 to 14 in schools and nearby government primary health center. The Health Ministry, the Women and Child Development Ministry, and the Education Ministry will combine together, and they help each other to roll out this vaccine in NIP in the age group of 9 to 14. And that will be the age group when we can see that the left out cases of TD vaccine, if they have not taken, they can be picked up. So this is a good move. And the main motto is that each girl should get this vaccine before entering the adolescent, 15 year of age group. One dose may be recommended or two dose. Now Serum Institute of India is having a lot of trial regarding the single dose versus two dose schedule in the 9 to 14 year age group. Once the results are ready, then the government is going to either adopt single dose versus two dose. So the time will say, but still then now the government has given this charge to the state level, and Bihar is the only state now, the first state to initiate this vaccine in the ministry of state ministry, and this vaccine is going to be rolled over first time in the country, in the Bihar, and taken up by the state government of health and family welfare. With that note, I must thank you all for your patient hearing, and I now it is open to Sriyan from IJCP. If there are any questions, I will love to answer. And before leaving, I must tell again a very happy new year to all of you. And whenever we are saying that this vaccine is the prevention is better than cure, the vaccines, they do not save the lives. It is the vaccination that save the lives. So as long as we are having this vaccine in the office practice, let us give to each and every, at least to the girls, to prevent cervical cancer. And now the boys are also not an exception to this. And if we can convince that this vaccine can be given to the boys, and definitely this vaccine is an additional additional boon to be given to the boys. With that note, I am closing here. Now it is over to Shriya.
Thank you so much, sir, for this wonderful presentation. We do have some question if you'd like to take that up.
Yes.
So, sir, the first question is, how effective has the introduction of HPV vaccination been in the reducing the prevention of high-risk HPV type?
Yes, high risk HPV type, as already told, what is the meaning of high risk HPV type? It is always said those serotype they cause cancer, they are known as high risk. Now 16 and 18 and other 5 types are known as high risk serotype. Now if we are giving this quadrivalent vaccine to start with, now let us forget about 9 valent in the office practice, 16 and 18 as the most common cause of high risk serotype in our country, in the globally as well. So now if it is taken up, definitely in the NIP, and we are going to decline the burden of 16 and 18 in the community. A time will come, both, if we are seeing decline of the cervical cancer in the women, definitely the burden, and we have seen that this virus can go from female to male as well, male to female as well. So that means the burden of this virus will decline. So if you see now over the years, in the last few years, the cervical cancer burden in those countries, those who have adopted this single dose versus two dose vaccine in 9 to 14 years, the cervical cancer burden has gone down very drastically. And you see the pap smear positivity also came down drastically. So I mean to say, if it is being included in the NIP, then only there will be a major change of this reduction of high risk serotypes in the community is possible. So let's wait for that day, and we are hoping, now we are in January, maybe in the mid or the ending of this year, we are going to roll out this vaccine in our country.
Thank you, sir. The next question is, what are the barriers to achieving higher HPV vaccination rates, and how can they be addressed?
Yes. Now the barriers are not, one is the education. Now people, I am a pediatrician. Now a lot of adolescent boys and girls, they come to us. Now question is that one is education, one is propagation, how what percentage of efficacy and effectiveness of this vaccine in the global scenario, in the country scenario. Now every girl should have this vaccine, that we never know. No one is immune to any cancer. A woman is going to die either because of cervical cancer or either because of breast cancer. Now there is no vaccine. If I say only cancer, which is possible by the 100% co-infection with the HPV, then why not we'll give this vaccine to be given? And it has been seen that the big people, there are examples are there. I can say, quote the name of heroine, we can say cervical cancer, the Goody, who was there once upon a time in the TV show, and Manisha Koirala, the celebrities, and so many are affected by this, and they have gone for hysterectomy and ovary removal. So before the cancer sets in, it is prudent, it is a right of a girl to get this vaccine. And now we have seen the many other cancers are also related to the HPV, and that's why now gender has gone out. Like MR vaccine, when it's launched over, it was only girls to be given. Now MMR is a irrespective of boys and girl, both has to be given. In spite the rubella is not causing any damage or any death in the boys, but still then we are giving as a triple component. The same thing I will tell that in case of HPV vaccine, the boys and girls to be given, which has been already approved by the DCGI in our country. And soon this vaccine, once it is rolled over, then only we see the major impact in the community. And to see the impact in the community, now this vaccine is available in the office practice. And we cater in the office practice, in the private market, only 9% of the immunization. But rest 91% of the immunization are catered in the government sector. So that's why we have to wait, and government is proactive to roll out this. I have already told, as of now, 144 countries, they have started in their NIP. But we are saying India is progressing. So why India will be a bar not adopting this in the NIP? So this is high time. The India has already told by the Government of Health and Family Welfare, it is going to be a part inside the what I say in the NIP very soon.
Thank you so much, sir. We have one last question.
Yes.
What are the most effective communication strategies to counter vaccine hesitancy among parents and adolescents?
Yes, there are many things are there, because many things people think this is a sexually transmitted disease. Now, vaccine hesitancy is very high in affluent countries or in elite countries or in educated or developed countries, but it does exist in India as well. Now, you might have seen in COVID when the vaccine came, even many elite and educated mass, they have a reluctance not to take the vaccine. But once they are convinced that this vaccine, COVID vaccine, is very efficacious, they came forward, and finally there was a hue and cry in the vaccine center to take the vaccine. The similar way, people are not aware that this vaccine is so important. It is not only going to cause prevention of one cancer, 100% association, and rather it is important for causing so many cancers, anal, penile cancer, and oropharyngeal cancer in male. So we must know that the education should reach to the community level. So that means that should be just these celebrities. I can say example. You see how polio has been eradicated from India 2014 onwards. How? Because the Rotary Club, this all NGOs, they came together hand in hand with the Government of Health, and this vaccine has been rolled over pan India, and the strategy of this oral polio vaccine as well as pulse polio immunization, everything came together to eradicate or to eliminate this virus from our country, and our country doesn't have polio virus as of now. So similar way, if we are adopting the message that do boon pilaiye and polio hataiye, similar way, now your girl, whether your girl is now 9 years plus, yes, if yes, never ever get a chance that your child may have this HPV cancer. So prevention is better than cure, and this is a very good vaccine. No major side effect or any untoward side effect is there, and 2 doses are enough, and you can take from the perspective as long as it is not included in NIP. Once it is included in NIP, like 144 countries across the globe, the same, so it will be given by the free of cost by the Government of Health and Family Welfare India. And the same now government has changed their policy now, and everybody is waiting that this will be adopted by the state government policy, and state government is going to bear the cost. And the same MOU has been done from the Serum Institute with Bihar, and Bihar is going to start and roll over this vaccine. Always remember, it is easy to declare, but to have consistency preparation. India is a very vast populous country, and I can say 148 crore population is not a joke, and that to 9 to 14 years girls, it is amounting to many a crore population, and that much of stock has to be there. And consistently, this must be available every year. Then only this has to be adopted by that particular state. But the days are not far, and very soon, because of the commitment of the present government and very active Government of Health and Family Welfare and the Ministry of Government of Health and Family Welfare, then Women and Child Development Ministry, and the Education Ministry. They all come together because this has to be given not only in the primary health center but also in the schools, that 9 to 14-year adolescent girls first they will be targeted to get this vaccine, whether single or double dose, that the time will say, but this vaccine is going to be rolled over in this year itself. So we are having now, I can say, अच्छे दिन आ रहे हैं. So I can say big good days are coming. But now in 2025, no one should die because of any vaccine preventable disease. Let it be tetanus, let it be diphtheria, let it be flu or any vaccine preventable disease. It is the right of human now to get vaccinated and not to die of that disease. So that much I can say. Over to Sriya.
Thank you so much, sir, for answering all our questions. That's all from our audience, sir. So, sir, before
Yes.
concluding, any take-home message from your end?
Any questions for the?
No, sir, we are done with the
No.
questions. That's all. Uh,
Okay.
so we are almost at the concluding part. So before concluding, sir, any take-home message from your end?
One message I can tell now, we the pediatrician are getting in our office practice in the OPDs a lot of adolescent girls and boys. Let us propagate, or one study will be there that we may not get time to educate regarding vaccination in our clinic. We can say this is a preventable cancer, and not only cervical prevention, it can have added cancers can be prevented by HPV vaccine. So any child turning 9 year plus, let it be boy or girl, should get this vaccination, and to recover or to not to have this type of fatal cancer in them. So prevention is better than cure. And if we are saying, then definitely, and if the doctors are the best ambassadors in their community, in their local language, if they have some saying in the local channels, TV channel, or audio visual aids they can propagate, then definitely more and more people will come forward. They will demand for this vaccine as long as the vaccine is not taken up in the NIP. So this much I can say.
Thank you so much, sir, for this wonderful talk. It's been really great again sharing the platform with you, sir. And thank you for joining us today. With your permission, I would like to conclude today's session.
Right. So thank you, Sian, from my end, and thanks all doctors, those who have logged in. And dissemination of knowledge is our power, and it is the happiness we get by disseminating what we know. And if you practice in your practice, then definitely that will be the best gift to the speaker. So thanks a lot, Jai Jagannath. Having a great day ahead. Thanks a lot.
Thank you, sir. Thank you.